Hi, I'm Dr. Cynthia Clark, acupuncture physician, applied clinical nutritionist, and creator of Energy Evolution with Longevity Wellness. And I want to talk to you today about cholesterol and statin drugs. There's been a lot of information in the media in recent years about cholesterol as it relates to cardiovascular disease and statin drugs and whether or not they're the right fit for you. And I want to talk to you a little bit more clearly about this today. First thing is that cholesterol and cardiovascular disease don't have as close as a correlation as once we thought that they did. I have a previous video on President Eisenhower and his journey of cholesterol being measured after he had his first heart attack. Over the course of his presidency, they kept him on a very, very, very low-fat diet, thinking that cholesterol was the problem. He had another 8 heart attacks by the time he left office on an exceedingly low-fat diet. He ate no meat, he ate only a couple of eggs a month, that was it. So the first question is, how much does cholesterol have to do with cardiovascular disease? The next question is, how much is the solution that you're being offered for preventing cardiovascular disease, how expensive is that solution? Not only in terms of money, but in terms of the effects on your body. So let's take a look at this. Back in the 1970s, if your cholesterol was 240 or below, you were considered healthy. Good job. Nowadays, it has to be below 180 to be considered healthy. What that does is it opens a very broad range, 36 million Americans, that are candidates for statin therapy. Okay, that opened a window, and we want to look into what the cost of that window is. Interestingly, if you have had a heart attack, whatever your cholesterol level is, even if it's really, really low, then you are considered a candidate for statin therapy. I would question this approach, because if you had low cholesterol and you had a heart attack, then it seems like the thing you don't want to do is to continue to lower your cholesterol. What are statin drugs? They are Lipitor, Zocor, Mevacor, and Pravachol. So you may know them as atorvastatin, simvastatin, lovastatin, and pravastatin. So that's what we're talking about here. And how do they work? Statin drugs work by inhibiting an enzyme called HMG-CoA reductase, inhibiting that enzyme and keeping your body from creating cholesterol in the first place. When statin drugs first came on board, they were considered very popular because the previous therapy caused a lot of indigestion and didn't lower the cholesterol very much. So statin drugs, from the perspective of lowering the cholesterol, they're very effective. However, is that what we really want to do? Consider a child born with a hereditary defect of low cholesterol, a defect of mevalonic kinase. This child was born mentally retarded, with a very, very small head. He was small for his age. He was profoundly anemic. He was acidotic, and he was febrile, and he also had cataracts. This is what extremely low cholesterol looks like. Why is that? Well, part of the reason is because cholesterol is what forms the cell, the wall of the cell. And so if there isn't an appropriate amount of cholesterol, there isn't an appropriate amount of cell barrier, and there's a lack of differentiation between what's inside the cell and what's outside the cell, and that's critical. Some studies have shown that statins can prevent heart disease, at least in the short run, and this is most likely explained by the inhibition of cholesterol reduction, but not by the inhibition of cholesterol production, but because they block the creation of the mevalonate. What this means is that it's a very, very short-term effect and is not effective long-term. Okay, cholesterol, we already talked about. This is what makes our cells waterproof. Cholesterol is the precursor to vitamin D. It is also necessary for the metabolism of all minerals in the body. It's also vital to our proper neurological function, and it's essential for memory and the uptakes of hormones into the brain, including serotonin, which is our feel-good neurochemical. By the way, cholesterol naturally tends to go up with age. It is considered to be an antioxidant because of this, because it may help protect us over time. In fact, it may even be considered an anti-cancer agent in the body. That's really good. We like anti-cancer agents, so we like cholesterol. Cholesterol is really good. Cholesterol is also the precursor to all hormones produced in the adrenal cortex. This includes all of our sex hormones, including testosterone, estrogen, progesterone. All of these things come from cholesterol, so we need cholesterol. Okay, when statin drugs came in, they were very effective, like we said. By the way, active people are a lot more likely to develop the side effect of statins than sedentary people. And the thought for that is because active people are using their muscles, so they notice them more quickly. The next thing that we find is that the statins affect our neurological systems. Taking statins for 1 year raised the risk of nerve damage about 15%. In one case, in one report, patients told their doctors that they had complained about neurological problems, only to be assured that their symptoms could not be related to cholesterol-lowering medication. That's simply not true. Not only is it not true, but that damage is irreversible. When I was a personal trainer, I had a client in one of my small group classes who was a really great guy, hard worker with good attitude, and in the middle of class one day he said, "Okay, that's it, great to see you guys, I gotta go." And he got up to leave, and I was new to the gym, so I was a little concerned that it had been my class that he was walking out of. And he said, "Oh, no, I took Lipitor, and now I just have permanent muscle weakness, fatigue that won't ever go away. I stopped taking it a couple years ago, but I'm stuck with this." I was astonished that a medication that he had taken would have these kinds of permanent effects with no warning about that in advance. Another issue regarding the neurological aspects of statins are whether they make us more accident prone. So for example, this is a story from the Washington Post. "My husband at age 68 backed into the garage and stepped on the gas, wrecking a lot of stuff. He said his foot slipped off the brake. He had health problems and is on medication, including a cholesterol drug, which is now known to cause problems with feelings in one's legs. In my little community, older drivers have missed a turn and taken out the end of a music store, the double doors of the post office, and the front end of a bakery. In Portland, a bank had to do without its drive-up window for a time. It's easy to say that one's foot slipped, but the problem could be lack of sensation. My husband's sister-in-law thought her car was malfunctioning when it refused to go when a red light turned green, until she looked down and saw that her foot was on the brake. I have another friend who mentioned having no feeling in her lower extremities. She thought about having her car retrofitted with hand controls, but opted for the handicapped bus instead." So the handicapped bus is a result of the side effect of taking the statin medication, which you are being given because you need to lower your cholesterol, and I submit that possibly that isn't even the case in the first place. So be sure to work with a qualified holistic practitioner, someone who really knows their way around these numbers, so they can help make sure that you're getting guided in the right direction, because it's important. Okay, next one, congestive heart failure. So this is when we start really paying attention to the data and the metrics. While the incidence of heart attack has declined slightly, an increase in the number of heart failure cases has outpaced these gains. Deaths attributed to heart failure more than doubled since statins have been introduced from 1989 to 1997. Interference with production of CoQ10 by statin drugs is the most likely explanation. The heart is a muscle, and it cannot work when it's deprived of CoQ10. And where do we get CoQ10? We get CoQ10 from meat. Cardiologist Peter Landshin studied 20 patients with completely normal heart function. After 6 months on a low dose of 20 milligrams a day, so 20 completely healthy patients on a low dose of Lipitor for a short period of time, 2/3 of the patients had abnormalities and the heart's filling phase when the muscle fills with blood. Without CoQ10, the cell's mitochondria are inhibited from producing energy, leading to muscle pain and weakness. The heart is especially susceptible because it uses so much energy. Yet virtually all patients with heart failure are put on statin drugs even if their cholesterol is already low. Other side effects can be dizziness, severe cognitive impairment, and by the way, check out the website spacedoc.com to see the story of former astronaut Dwayne Graveline and his book Lipitor, Thief of Memory, and all of the cognitive problems he had with that. He suffered what's called a global ischemic attack, which means he was standing in his front yard and couldn't remember who he was. Former NASA astronaut. By the way, in every study with rodents to date, statins have caused cancer. Why is this not publicized in humans? Because it takes a lot longer for humans to get cancer than it does rodents. In every study, rodents have gotten cancer. In one trial, the CARE trial, C-A-R-E, breast cancer rates of those taking a statin went up 1,500%. 1,500%. Also pancreatitis, also depression. And the question is, are there any benefits? And I submit to you that in 2 of the studies that were done, more deaths occurred in the treatment groups with statins than occurred in the control groups. So it's a very, very, very serious decision to make. And I encourage you to be thoroughly educated before you take a medication which is not needed to lower cholesterol, which likely isn't needed to be lowered, with severe side effects that affect your memory, that affect your moods, that affect your ability to use your muscles and your nerves. Thank you. This is Dr. Cynthia Clark with Longevity Wellness.